Welcome back, everyone, to the RMS experience. And today we're very excited to have another guest with us. We have Anna Pozzi here, who is the new lead for Back2Life Pain Management. So thank you so much, Anna, for joining us today.
Thank you, Jenna. Thank you.
Yes, we're excited to dive into your journey today. So, first of all, can you please introduce yourself to our audience?
Yes. So, first of all, I'd like to say that I'm very happy to be here and to share a little bit of my experience. And my name is Anna. I'm Brazilian. I graduated in medicine in Paraguay in 2024. And during the week I graduated, I saw the opportunity to join MSK MSO, and I felt very prepared to working with them. Since I already had experience from working, especially through many volunteers activities during the medical school. So I went through the intervals, first in Spanish and then in English. And since then, I have been learning and growing with the organization. And first, I started as general surgery, and later I moved to Back2Life Pain Management. And now I'm working as the lead in this practice since Stephanie, who was doing an excellent job as lead, she is going to start her maternity leave. So as lead, the responsibilities are greater, but I'm very excited to continue learning, growing, and helping our team to provide the best care possible to our patients.
Well, thank you so much for introducing yourself to our audience. So it's great to know all that about you. Thank you for sharing. And it's clear that your training and values will set the tone for how you lead the team. And let's get a quick picture of the practice that you lead, which is Back2Life Pain Management. Can you introduce it to us or tell us how would you describe the care philosophy of the practice?
Yes, the Back2Life Pain Management, it's a pain management clinic that takes care of people with chronic pain in a very human and responsible way. So our goal is patients who often comes to us with big health challenges. So we work in several facilities and also in hospitals and helping different patients. And we have a team of dedicated providers who really care about each person. So we also see patients through telehealth, patients referred by other doctors and workers' compensation patients. So here, every patient is treated with attention, care, respect, and that's all. I'm to be part of this team.
Yes, well, thank you so much for letting us get to know the practice a little bit. It is very helpful. And now let's look at how that comes to life in your day as the new lead. Can you walk us through your day?
Yes. So as the lead at Back2Life Pain Management, my routine involves coordinating the remote medical staff team, monitoring process performance, provide the individual support to professionals, and acting as a link between the management and medical teams. So I usually start my work in the afternoon. And the first thing we do at the beginning of the shift is checking painting tasks like messages, faxes, emails to understand what is happening with each patient and each provider, and if any provider requested something. And next, we check the CT requests to send prescriptions to patients in the facilities. We also adjust and translate telehealth appointments so the provider can see the patients in other languages, such as Spanish. Organizing patients' charts and reviewing patients' notes is also part of the routine. And we are always in contact with the facilities and with patients' nurse requesting important information. And we also keep in touch with medical records department of all the facilities to make sure all the documentation is complete of the patient. So this allows the provider to have access to the EMRs from facilities and hospitals, so we can closely follow everything related to the patient's health. And we are currently in a time of growth for the practice. So we have many new tasks daily. and our team is dedicated to handling everything necessary to support this growth. We have a really great remote medical staff team, and we focus on responsibility, organization, communication. So this way, we always working during the shift to give the best support for the providers, the practicing, and the patients.
Thank you so much. It's very clear and structured. And yeah, that flow shows how leadership supports both the team and the patient experience. So let's talk about your life as an RMS within MSK MSO. What is it like to work as an RMS, and what did that experience give you as a foundation?
Working as a remote medical staff at MSK MSO, it's a very positive and challenging experience. Even working from our own country, we can different clinics, professionals, patients, and learn to handle many different situations. So this work help us to grow as professional, as people, and especially as doctors. So for those who don't have English as a first language, it's a great chance to improve communication and to learn to solve problems in other languages. So during the work, we learn to handle challenges, work in team, and collaborate with different people, which helps us and grow in many areas of our career. And we also learn about different healthcare systems and like American system. So understanding how clinics, hospitals, and care coordination work. So being a remote medical staff at MSK MSO gives us a real experience with diverse clinical situations, improve our medical skills, teach us to be organized, attentive to details, and prepares us to care of patients efficiently and safely.
Yeah, thank you so much for sharing that. And it would be great to hear a moment that shows this in action. Can you share one of your highlight moments from your journey as an RMS and as a lead?
Yes. One of the most important structuring the practices workflow in a short period of time, with the goal of getting every day and reaching strong growth. So for this, we are using a clear and collaborative work with attention to results. So this moment is very special because it represents not only a challenge, but also a great chance for progress. And we are adjusting routines, improving process, and making the team communication stronger so that the practice can keep growing and give even better support to both patients and providers.
Love that example. Yeah, it really links to the process of real patient results. So I wanted to close this interview with discussion on why RMS is a strong partner for clinics. Why do you think, why should medical offices and providers partner with MSK MSO to hire RMS?
So medical offices and providers who partner with MSK MSO gain access to highly professionals and qualified professionals. Many of whom are doctors from different countries. So this brings a unique level of responsibility, knowledge, and attention to detail that is essential when working with patient care. So our team is used to handling complex situations with focus and care. We always aiming for safe and efficiently results is not necessary to have a fixed office. And with talent from many nationalities, we can adapt the schedules and make sure there is always support available to at the time each practice needs. So by choosing MSK MSO, practices receive not just workforce, but a trusted strategic partner that improves patient satisfaction and helps the practice grow stronger and every day.
Thank you for sharing that. Yes, that makes the value clear. Better flow, better data, and more time for clinical care. And also for the viewers who want to learn more about RMS or Back to Life Pain Management, they can do so in our website, which is in the description below. And Anna, thank you so much for all your insight today. Thank you for taking the time to join us.
Thank you. Thank you, Jenna. Thank you all.
Thank you. To the audience as well, thank you for watching, and I hope you like and subscribe for more practice spotlights.